I worked as a food server for 18 years. My employer gave us a health care plan that was very good. It was a couple $100s a month for a family plan. And we had that for about 10 years that I worked there. And 2001 came, and the employer started takeaways. First they took away our vacation, and then they took away our health care and gave us a different plan. It was not as good, and but I bought it because I figured some insurance is better than no insurance at all. In 2005, my husband and I were at a football game. It was a real hot day, and when we left, I felt dizzy and I fell. And I was concerned, so I went to see my doctor, and he did blood tests, and everything was fine, but he wanted me to get a mammogram because I lost my mother from breast cancer in my 20s. I got the mammogram, and 2 spots showed up. So they sent me to get a sonogram, and the sonogram showed 2 separate masses. They wanted to do a stereotactic biopsy, and that's where they go in and they take everything out. They did the stereotactic biopsy and told me that it was a precancerous condition, like a calcium deposit, and that I would need to start getting checked every 6 months. A couple of weeks later, I started getting bills, and I got bills for the doctor, bills for the surgeon, for the mammogram, and for the sonogram, and then the stereotactic biopsy was $10,000 just for that. Of that, my insurance company paid a couple $100, and so I was, you know, I really couldn't afford to pay that. And I was talking to a friend, and she told me that I should go to the hospital and apply for help. And so I did apply for help, and I would have qualified except for I had insurance, and it was for people with no insurance at all, so I didn't qualify. I set up payments, and it took me a few years to pay it off. And during that time, I got calls from the bill collectors harassing me and asking me to send more money. And it was really, I think, quite unfair that that I thought I was being responsible by getting insurance, and then it ended up costing me more than if I had no insurance at all.